What's up, everyone? I've seen a lot of people make videos about their experience with different surgeries, especially orthopedic surgeries, because they're so kind of hit or miss. Some surgeries are good, some surgeries are not all that effective. Um, uh, and I feel like it's a good resource for people to be able to watch other people's experience with specific surgeries. So tomorrow, or I'm sorry, not tomorrow, this morning, I'm going to have a labral repair. I have a tear in my labrum on my left shoulder. I'm not exactly sure. I'm like constantly like side to side. I'm in the middle of a field. It's not a slap tear. It's not a Bankart tear. I believe it's like it's a small tear on like the inferior portion of the labrum. It's not like a really substantial tear. It's fairly small, and that's part of the reason why I waited so long to get surgery, is because I have pretty good functionality. I can, shoot a bow and arrow. I can, it doesn't really affect my life all that much, but it does affect my ability to work out. I can't bench press. I can't do a pull-up. And that's really been a major bummer for about a year. I think I originally injured it skateboarding like 6 years ago, and then it just like got worse and worse. Like I was exacerbating it with my working out. But it's it's a major bummer. And part of the reason it's been so difficult to actually actually execute on getting the surgery is because it hasn't been like horrible. It hasn't impacted my life so much that I'm all in on getting the surgery. But finally, I just thought this was a good time to pull the trigger and do it. But I'll be periodically updating with respect to my experience. So I don't know, every month or so, I hear the recovery is something like 6 months, and like full, strong functionality in 8 months to a year. I'm assuming my recovery will be shorter just because my tear is not that substantial, and who knows the extent to which this has an effect, but I'm going to like a pretty good surgeon. He does like 300 arthroscopic shoulder surgeries every year. So he's, I took almost like painstaking measures to find a surgeon that does this a lot and that I was confident in. But again, I've never gotten surgery before. I've never been under general anesthesia before. So this is definitely a bit nerve-wracking. I don't know. I don't know what to think. It's a very weird feeling. I feel like it just kind of crept up on me, the surgery date, because I was like going to work and like doing everything normally, and now I'm going for surgery in a few hours. So, yeah. I think the major thing I'm worried about is just that it won't work. I was reading a paper, it was published in 2017, and it compared people who got labrum repair surgery, because this isn't something that's often done in surgery. I've been noticing they don't like with a drug, they'll compare the drug to a placebo. With surgery, they can't really do that. That's not always considered ethical to do a placebo surgery. So there are many surgeries that they're now testing, like using placebo control, like they're using a sham surgery and then the actual surgery, and they're finding that this surgery that we've been doing for years has almost no effect on the condition that it's trying to treat. It's just, whatever effect that patients, whatever improvement patients are having, it's just the placebo effect. They would have been just as good with a fake procedure. So again, I believe the first study of this sort was published in 2017 with, I think there were like 80 participants. 40 got sham surgery, 40 got the labrum repair, and they saw very little difference at 6 months. I think it was like 6 months, a year, 2 years. Their outcomes were what's interesting is all of their outcomes were better across the board, but there wasn't a substantial difference between the group that was got the actual labrum repair and the group that didn't. So that's giving me a bit of apprehension. I almost wish I hadn't read it, because you have to think, okay, I have this new information. What do I do based on that information? It doesn't really change my plan, because there's really no other course of action. Like, I have my shoulders screwed up. There's really no other way of fixing it. Like, there's no alternative option. It's just like live with a shitty shoulder, or, you know, try some intervention. So this is what I'm trying. But that definitely kind of threw a wrench in my whole idea of like whether or not I should get surgery. Because what it implies is like, okay, you're going to go through this 6-month recovery, you're going to go under anesthesia, you're going to deal with all this, and you're going to have no results from it. You're going to be just as good as you would have been with a fake surgery. So, but again, this is an 80-person study, and I have nothing like, you know, there's no real other option for me. What I think could be going on in this study, what could be possible. Again, it's a small sample size that hasn't been replicated yet, so you can't put a whole lot of stock in it. But what I think could have happened is labrum tears are often misdiagnosed. Actually, a huge portion of people, and especially people over the age of like 40, 50, have labrum tears and they're asymptomatic, but they'll show up on an MRI. So often people will say, oh, I have pain in my shoulder, let me get an MRI, and oh, you have a labrum tear. But that doesn't establish that like that labrum tear is the cause of their pain or instability. So they may get labrum repair surgery and there's no difference, because that's not actually what's, you know, causing their pain. So they're fixing something that isn't, you know, the root cause. So I think that could have some effect on or that could explain, you know, part of the study's like kind of bummer result for this surgery. But again, it's inconclusive, and there really is no other course of action. So this is what I decided to go through with. And the kind of window to do this sort of was closing for me, because I'm still young. I don't have any bills. I live with my parents. This is not something I would be able to do, especially with COVID going on right now. There's not a whole lot I'll be missing out on. But so it would make sense to do now. I probably won't get as good an opportunity in the future. So, and also, I think there's a major upside. If it works, like, awesome. I can go back to doing, you know, the things I like to do. So, yeah, I don't know. I guess you got to just weigh your risk reward for this, but we'll find out. I've gotten a lot of therapies before that have, you know, that are backed by sort of like anecdotal evidence, and I feel like again, I think everyone thinks this, but I think I'm a pretty good judge of the actual efficacy of an intervention. I'm not super suggestive. I'm very much a skeptic. I've gotten, you know, PRP injections, and I've gone to physical therapy, and I feel like oftentimes people will think like they'll be effective because people believe they're effective. Not to say that PRP and physical therapy are ineffective, but I think some people can be fairly suggestive, and they can think they've improved when they haven't actually, or at least their improvement is just them again thinking that they got better. And actually, I have PRP for my shoulder from a dude who was so confident in it working, like, across the board, and I knew it wasn't all that, you know, there wasn't any data really published on it, so I went in pretty skeptical. So all these like rave reviews, and it did nothing for me. Like, there was no benefit at all besides, you know, losing $1,000. So I'm definitely, I'll give this surgery as honest a review as I can. I'll try to correct for, you know, a false sense of progress or improvement, and just give like kind of an honest review of it. But again, if I have terrible results, that doesn't mean you'll have terrible results. If I have great results, also that doesn't mean that you'll have great results. But I think it's just, I feel like it's comforting to just have one data point, one person's story, before you go through it yourself. You can just kind of, you know, use me as your guinea pig. What else did I want to mention? Not a whole lot. I'll do these updates periodically. The first month I'll be in a sling, so I guess I will, maybe I'll do an update today, maybe, or tomorrow after my surgery, just to explain, or just to talk about like how much it sucks, how much, you know, how much pain I'm in, yeah, and just give my